Gibb. Thank you so much for being with me today. Today is part 5 of a 5-part series on digestion. And today I'm going to talk about intestinal permeability or leaky gut. It should be the lack of intestinal permeability. So typically, what is normal? You have your villi that line your colon, and they're like shag carpet, like longer shag carpet. And so that allows for good absorption. And you also have narrow gut junctions. They're cell junctions. When you have an impaired gut or intestinal permeability, then the shag carpet are like nubs, and the gap junctions are widened so that proteins can get down through there that normally can't from your food. So the two things that regulate that are zonulin and occlutin. And zonulin disassembles those tight junctions, so the food can't get down through there, and disassembles it and widens that. There are several autoimmune, inflammatory, neoplastic diseases that have been associated with increased zonulin. Celiac disease, irritable bowel diarrhea, type 1 diabetes, liver disease, and muscular sclerosis all have increased zonulin. So what are some reasons for the intestinal permeability? First of all, you can have small intestinal bowel overgrowth, and that is typically when the bacteria from the colon migrate upstream to the small bowel, and they're at a place where they're not supposed to be, and they have a lot more bacteria there. You get bloating, gas, etc. Protozoal infections, chronic alcoholism can cause intestinal permeability, irritable bowel syndrome, Alzheimer's, Parkinson's, strenuous exercise. So a lot of professional athletes, they get intestinal permeability because they really limit their, really strain their bodies every day for when they exercise. Increasing age is another reason, and nutritional depletion. So all those are reasons for intestinal permeability. So you look at what happens. So there's wheat and gluten related disorders are all on the rise. And they said since the 1950s, every 15 years, celiac disease has been doubling in the United States. There's also a separate category now that you can be tested for celiac disease but be negative for the antibodies, etc. But you can just have a sensitivity to gluten or wheat, and that's called non-celiac gluten sensitivity. And they really feel like this is potentially 10 to 20% of the population now that has this. So 90% of patients with celiac disease are undiagnosed. The symptoms usually occur about 7 years before the diagnosis. The one thing that we talk about, the genes haven't changed, but 30% of the genetic population, of the general population, has a genetic susceptibility, but only 3% will develop celiac disease. This celiac disease has been increasing in developed countries also. So why is celiac disease gluten intolerance on the rise? What is the main reason for that? They call the number one hypothesis is a hygiene hypothesis, because everything's really, we don't let our kids play in the dirt. We wash our hands after you touch anything. And they really feel like because of increased cleanliness, there is an increase in autoimmune diseases and an increase in allergies. The second reason is there's an early introduction or large consumption of gluten into the diet early in life. The third reason could be intercurrent illnesses like gastroenteritis, have an inflammation of your stomach, surgeries, trauma, they're all potential triggers. In the pattern of infant feeding, a lot of people now, of course, the lower risk is with breastfeeding, but a lot of people now don't want to breastfeed. They don't want to have to take the time to pump or do that if they're going to go back to work, so they just use traditional formula for that. But by 6 to 9 months of age, typically most infants are tolerant to foods. So what are some hypotheses? They think early in life, Early in life, there's infections like rotavirus, which sets a baby up for that. Infectious gastroenteritis in adulthood. They have dysbiosis, or the microbiome changes are out of whack. And then glyphosate or Roundup herbicide use prior to harvest can change the microbiome of the gut. So what induces the loss of tolerance to gluten? Many people say that it typically is the composition of the gut microbiome. There's 150 more genes in the gut, and so that potentially could be a reason. And people ask me many times, what about wheat proteins? Like what are they? So gluten is comprised of gliadins and glutenins, and that's 75% of wheat proteins. And then albumin and globulin also is a wheat protein. So they find the most immunogenic peptide in gluten, that's the one that's going to cause the most changes, as a unique 33-mer gliadin fragment. I know it's kind of technical, but that's kind of what they feel happens. But it is resistant, completely resistant to enzymatic degradation, which means it cannot break down. The body has never developed an enzyme to break down gluten. And so a test that's done in the blood is called TTA, tissue transglutaminase, and that leaks from the damaged cells into the bloodstream, and they do an anti-TGG sensitive lab test for that. So you say, how do you test for gluten to really see that? First of all, Genova has some tests that checks for zonulin. And there's other blood tests that we can check for gluten autoantibodies, and it's IgA testing. TGG, I talked about, anti-tissue transglutaminase. DGP is another one, deaminated gliadin peptide. I know these are technical, but they do IgA and IgG testing. And then a confirmation test that it's done, it's called EMA, or anti-endomysial antibody test. Make sure when you are testing these that you are on gluten for at least 2 weeks whenever you test for that. You can't be off of gluten when you test, because then the antibodies will probably be negative. And one of the things that we do have here, if you want to consume gluten, it's called Gluten Aid. And Gluten Aid, basically all it is some varying strains of probiotics that help break down the gluten. Because remember, we cannot develop an enzyme to help break down gluten. So today was part 5 of the 5-part series. If you'd like to learn more, look up the other 4 parts, and I'd love to help you on your journey to good health, so just give me a call. Thanks a lot. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.